Hi, everybody, and welcome to the Hair Talks for December 2024. This is part of Global Cosmetic Surgeries, um, teaching courses. Global Cosmetic Surgery was started in 2020 at the time of the pandemic, where a, a couple really bright forward-thinking clinicians, Deborah Shomei and Tanish Naka, started bringing clinicians together virtually when a time when we had no teaching to cover everything in the world of cosmetic surgery. That we covered everything during the pandemic. And then since then, they've been working with different groups and different societies to promote the things that are the most interesting in our field. So the aims of the Global Cosmetic Surgery is to refine educational programs, promoting best practices, encouraging research, fostering international collaboration and advocacy for cosmetic surgeons and really for our patients. It seeks to create a global community of cosmetic surgeons who share knowledge, expertise, and commitment. And again, there's been lots of events, and one of the flagship initiatives has been these sessions we call Hair Talks. This is we're doing every month or every other month, depending on different things. But the mission is to create to convene the foremost experts in dermatology and aesthetics. We have one for you today to share their invaluable field of trichology and what we do in the hair world. And so again, this is something we want people to really come and enjoy and like, and it's just a really fascinating, it's been a fascinating way for all of us to communicate and a way for us to learn. So again, my name is Michael Gold. I am the moderator for this Hair Talks group. And I thank the team from Global Cosmetic Surgery. We all have these backgrounds that say QR678. We want to thank them as being our sponsor. And today we're going to get right into our program. So our program is going to be talking about a fascinating topic, which is AI in hair. So our keynote speaker today is Dr. Arshan Ommid, joining us from La Jolla, California. So it's 7:30 in the morning my time. It's 5:30 in the morning his time. So I really, really thank him. We both got the purple memo today. I think you're wearing purple. He holds a distinguished academic background, having studied biochemistry and biophysics at both the University of California, San Diego and UC Berkeley, graduating in the top 1% of his class. During his time at UC at San Diego School of Medicine in the Department of Cellular and Molecular Medicine, he excelled as a researcher, earning multiple awards for his contribution to advancing professional knowledge through leadership and contribution to research advancements. He has been invited to deliver lectures at esteemed institutions, including UC Berkeley, Stanford, focusing on innovations in diagnosing, prognosing, and treating hair loss pathologies. So currently, he is the head of translational medicine and device development at La Jolla Cosmetic Dermatology, and he's the CEO and founder of Dermos, a pioneering medtech company and telehealth company. Dermos combines teledermatology, pharmaceuticals, and advanced technologies like deep learning, computer vision, and artificial intelligence to revolutionize the management of chronic and progressive derm conditions. The robust platform enables personalized therapeutic interventions, disease prognostication, and remote patient monitoring, offering an unprecedented level of personalized care to our patients and his patients and needs. In addition, he's an advisor to the University of California, San Diego School of Medicine MedTech Accelerator HealthLink, where he previously served as president. In his role, he collaborated with physicians and surgeons across diverse specialties, dermatology, endocrinology, gynecology, urology, to advance and commercialize life-changing medical devices leveraging AI. Please join me in welcoming Arshan Ommid, a visionary leader in the forefront of medicine, technology, and patient-centered care. So that's our introduction. That's fascinating. I can't wait to hear everything. So Arshan, you are on.
Awesome. Thank you, Dr. Gold, for the warm introduction, and a special thanks to the entire team behind the Hair Talk series for organizing this incredible platform. It's truly an honor to be here today, surrounded by such esteemed pioneers, thought leaders, and innovators in the field of cosmetic aesthetics. Today, I'm particularly excited to discuss a topic that's both timely and transformative, leveraging big data and advancements in artificial intelligence to usher in a new era of personalized medicine. We'll explore how these powerful tools are reshaping the diagnosis, prognosis, and treatment of hair loss disorders, offering unprecedented precision and patient-centered care. To maximize your engagement, I encourage you to focus on the key concepts we'll cover today. This presentation is being recorded, so you'll have the opportunity to revisit the nuanced details presented on the slides at a later time. Given our limited time together, I won't delve into everything detailed on the screen, but will instead emphasize on high-level core ideas and concepts. Feel free to take a second look at the recording to dive deeper when it becomes available. All right, so I'm going to go ahead and share my screen and we'll get started here. Okay, as a disclaimer, I'm a co-inventor and stakeholder of the parent organizations responsible for the research and innovation discussed herein. I'm not a licensed medical professional. This presentation is based on my research and is not intended as medical advice. Some of the images and statistics are sourced from third-party research and are cited accordingly. At Dermos, we believe that confidence is the foundation of a fulfilling and successful life. As dermatologists, plastic surgeons, and specialists in treating hair loss pathologies, we deeply understand the pivotal role hair plays in shaping self-esteem and personal identity. The connection between hair and confidence is truly transformative. It empowers individuals to pursue their goals, build meaningful relationships, and embrace a deeper sense of happiness. We've all witnessed firsthand the profound physical, mental, and emotional transformations our patients can experience from successful hair loss treatments. My personal favorite is when a patient, for the first time in a very long time, smiles at their reflection in the mirror. In that magical moment, the patient changes the perceptions of the possibilities of what they can achieve, inspired by the confident reflection in the mirror. These transformations are why we do what we do, and I'm honored to be a part of the solution with you all and contributing to this cause. Unfortunately, successful results like these have historically never been guaranteed, and in many cases are never achieved by the most desperate of patients, even after the use of combination therapies, including topicals, orals, photobiomodulation devices, autologous therapies, other injectables, supplements, natural remedies, and wound healing mechanisms. Hair loss is a rather complicated condition. Its etiology is multifactorial with many different triggers, including but not limited to one's genetics, such as their protein expression, epigenetics, their hormones, such as thyroid levels, DHT, prolactin, cortisol, their health and nutrition, such as nutrient deficiencies or surpluses, malnutrition, malabsorption, heavy metal toxicities, their lifestyle, such as sleep patterns, their hairstyle, hair care products, alcohol consumption, tobacco use, extreme exercise or weight loss, stressors such as physiological, physical, and emotional stress, anxiety, depression, sleep deprivation, childbirth, surgeries, loss of a loved one, the use of medications such as retinoids, birth controls, beta blockers, calcium channel blockers, and so on, and other comorbidities such as endocrine and hormonal disorders, hypo and hyperthyroidism, polycystic ovarian syndrome, autoimmune diseases such as rheumatoid arthritis, psoriasis, and dermatological conditions, including seborrheic dermatitis and other forms of scalp inflammation. For this presentation, we'll briefly review the current standard of care and best practices on a high level, and then discuss several unmet needs relating to the diagnosis, prognosis, and treatment of hair loss pathologies, AI-driven solutions, including novel clinical and research tools, and finally, opportunities for involvement. Although hair is a smaller practice of medicine for some in the broader practice of dermatology, its etiology can be complex and nuanced, leaving even those exclusively dealing with hair loss to engage in lengthy consultations and sometimes an inability to give a rapid diagnosis, even a comprehensive one. A proper diagnosis starts with a detailed conversation with the patient to discuss chronology of disease onset and progression, their lifestyle, health and nutrition, stress levels, menses, pregnancies, menopause, use of drugs or other medications, past health, family history of hair loss, hair products, and hair care routines. A complete physical examination to assess hair breakage, thinning, patching hair loss, texture, length of the hair, global pattern and distribution of the hair loss. Next comes dermatoscope-assisted examination to assess inflammation, the existence of scaling or symptomatic pain or burning. And finally, the phenotypic biomarkers associated with proper classification of the hair loss pattern or patterns, plural, that can coexist for a patient. For example, hair diameter diversity, loss of multiple hair units, peripillar signs and yellow dots, and androgenetic alopecia. Please note that these are not exhaustive lists. Perifollicular scaling, hair cast, and dystrophic hairs and lichen planopilaris, hair diameter diversity and perifollicular scaling, and single hair follicle units and fibrosing alopecia. Peripillar white-gray halos and CCCA, perifollicular scaling, lonely hairs, and absence of vellus hairs, and frontal fibrosing alopecia, to name a few. Regular healthy and unhealthy scalp examinations are crucial to correctly performing a differential diagnosis. Given that not all of these phenotypic biomarkers are present for all patients within the same disease category, oftentimes a diagnosis is not given during the consultation, and rather a biopsy is taken. We have seen that dermatopathologists prefer 2-box punch biopsies, 4 millimeters cut vertical and transverse, especially if dealing with the scarring alopecia. There are many different types of hair loss, and it's estimated that about 1/3 of hair loss sufferers are comorbid with multiple types of hair loss. And here's where the first application of artificial intelligence, particularly computer vision, holds a lot of companion diagnostic merit. By training an algorithm on the phenotypic biomarkers, which our computer scientists call features, we can actually, for the first time, automate and quantify the existence of biomarkers that each patient has, and locally to the different regions of the scalp. Computer vision AI algorithms can output the necessary data required for a differential diagnosis by providing quantitative metrics relating to the aggregate of biomarkers associated with all hair loss patterns. Here are a couple examples of the AI in action for hair thickness, density, and terminal vellus ratio calculations. The physician can simply view the output, ultimately providing more than several benefits, such as increases in the diagnostic diagnosis efficiency and accuracy of correctly identifying the hair loss pattern or patterns. We are currently working on a version that actually displays an overlay on the original image of the patient's scalp, identifying hair loss related biomarkers physically on the image as opposed to just a quantitative printout. This has the potential for self-guided mastery of hair loss histology for less experienced practitioners. This data is then cross-referenced with the pre-existing database of blinded patient scalps images that were previously labeled with the associated hair loss pattern, and the AI outputs a diagnosis with a provided confidence interval. The physician can then cross-reference their analysis with that of the computer, serving as a companion diagnostic. Ultimately, this will help increase the confidence of the patients during the diagnostic process, increase the accuracy of the diagnosis, reduce the amount of time, the amount of scalp biopsies required to send to pathology when AI confidence interval is high enough, saving the patient money, and ultimately shortening the diagnosis life cycle so treatment can begin earlier. Now, let's discuss the lab workups. Hair loss often involves comorbidities that, if unaddressed, can render medical therapies less effective or not effective at all. Depending on the patient's age and sex, we typically recommend a tailored set of labs, such as those listed here. These include thyroid function tests, hormone panels, nutrient levels, and inflammatory markers. Identifying underlying conditions is absolutely crucial. For example, it's not uncommon for women presenting with hair loss to uncover previously undiagnosed PCOS, which significantly impacts treatment decision. Similarly, unrecognized thyroid dysfunction can prevent other therapies from working effectively. And this is why referrals to endocrinology and gynecology or other specialists are often necessary, although they may still be underutilized. A noteworthy perspective that we've adopted is provided by one of our colleagues and collaborators, Dr. Neil Rouzier, a pioneer in bioidentical hormone therapy and author of How to Achieve Healthy Aging. Dr. Rouzier teaches CME courses at WorldLink Medical and argues that the conventional medical approach of treating patients to normal lab values may not be enough to achieve optimal health. He emphasizes the importance of individualized, precision-based medicine, advocating for treatment based on optimal levels rather than merely normal ranges. Dr. Rouzier asserts based on his experience that many common symptoms, including fatigue and hair loss, can often be improved or resolved by addressing underlying hormonal imbalances and optimizing hormone levels beyond the standard reference ranges. For example, in the case of thyroid levels, many individuals with hypothyroidism have normal TSH levels, but still experience symptoms like hair loss. Dr. Rouzier argues that optimizing thyroid levels by looking at a broader range of thyroid markers, such as free T3, free T4, and reverse T3, and aiming for levels that promote wellness, not just normalcy, can help restore hair growth and resolve other symptoms associated with suboptimal thyroid function. Quote, "The body conserves energy whenever it can. If the thyroid hormone production is not optimal, the body will shut down those functions considered non-essential, such as hair growth. If you want your hair to grow back, you'll need a higher level of thyroid hormone than normally found in your body. Even normal thyroid hormone levels may not be adequate for many women to retain hair." This is just one high-level example that has its own set of nuances. However, it's important to be cognizant of the normal isn't optimal concept when prescribing, reviewing labs, and or making referrals. Now, building on this approach, we began developing an AI-powered platform that integrates lab results, comprehensive medical history, and trichoscopy data to flag lab values within the normal ranges that may still require further optimization. This approach addresses both clinical conditions and patient-reported symptoms, moving beyond traditional training that focuses solely on treating overtly abnormal lab results. By continually refining our algorithms with more training data, we aim to provide personal insights for optimizing health outcomes, even in areas beyond endocrine and hormonal profiles. Next, let's briefly review the different treatments that we commonly use for hair loss. Assuming that other comorbidities are addressed that are traditionally considered out of the scope of practice for hair restoration clinics or dermatologists, we usually provide a mixture of the following combination therapies for androgenetic alopecia, but also for several other types of pathologies too. Topicals, orals, photobiomodulation devices, autologous therapies, other injectables, supplements, natural remedies, and minimally invasive devices targeting wound healing, such as microneedling. Of course, there are other treatments for different hair loss pathologies, such as autoimmune and scarring alopecias, which I will refer you to watch a previous Hair Talks lecture series elegantly given by Dr. Glynis Ablon on the topic of female pattern hair loss. In my experience working alongside physicians who treat hair loss pathologies, it's often like navigating the Wild West. Treatment pathways can be chaotic, with subjectivity, personal biases, and varying experiences leading to vastly different treatment recommendations. And this is not only during the treatment process, but also during the diagnostic process, which we previously discussed relative to the broader scope of administered labs. This lack of consistency can leave patients disillusioned. Those who have already tried various combination therapies might prematurely dismiss a previously suggested treatment, despite the fact that a different combination could have been the key to success. As healthcare providers, we're trained to manage expectations, but the reality is, how many times can we give a patient hope before they lose faith? How many attempts do we get before they give up? We've all witnessed this frustration, and it's deeply a disheartening feeling. There is a delicate balance that we must strike, offering optimism and encouragement to start treatment while also managing the risk that despite our best efforts, the treatment might not work. It's an emotional tightrope where the hope we provide is counterbalanced by the inevitable fear of disappointment. This dichotomy is an unfortunate reality we face in this field. For now, let's dive into the prognostication process and some recent advancements in the area. Hair loss is a chronic progressive disorder that can begin as early as the teenage years and, without innervation, may advance to a Norwood 7 pattern by age 30. The progression is highly variable. Some individuals might rapidly progress to Norwood 5 within a few years and then plateau for a decade, while others may experience minimal additional loss until their 40s and 50s or later. Physiological changes and fluctuations in biomarkers associated with hair loss, such as hormonal shifts, often dictate the timeline of progression. To encourage timely intervention, we often illustrate the concept of hair loss progression by mathematically projecting the limit of hair loss over time. And this allows us to demonstrate the potential trajectory towards advanced stages like a Norwood 7. While the exact endpoint of hair loss remains uncertain for each individual, this approach helps contextualize the urgency for treatment. That said, a more significant question patients frequently pose is not about the ultimate pattern they may reach without treatment, but rather, will this treatment grow my hair? What's the trajectory of regrowth? Answering these questions with precision is at the heart of our focuses in personalized medicine. Without reliable prognostic biomarkers, we struggle to assure patients that their treatment plan will yield meaningful results, eroding trust and adherence. The introduction of credible predictive tests could bolster patient confidence and improve treatment compliance. As an example, the most widely used over-the-counter and prescribed medical therapy for hair growth is topical minoxidil. However, as a monotherapy, 5% topical minoxidil demonstrates a suboptimal efficacy rate of approximately 40%, leaving nearly 2/3 of its users without any significant results. Given this limitation, a rapid diagnostic test to predict minoxidil response would clearly be of clinical value, allowing for better treatment personalizations, compliance, and confidence of both the physician and patient in the treatment. In discussing advancements in prognostication tools, and before continuing further, I'd like to take a special moment to acknowledge Dr. Andy Gorin, who is with us on the call here today. Dr. Gorin has pioneered several transformative innovations in the field, including the development of the first clinical genetic test for predicting androgenetic alopecia. He was also the first to identify epigenetic markers that predict anti-androgen therapy response in females with androgenetic alopecia, and he developed the groundbreaking diagnostic test to evaluate the efficacy of topical minoxidil. Dr. Gorin, it is truly an honor to speak here today at your invitation. You have been an inspiration to me, my team, and undoubtedly to many in attendance here today. With great respect for the foundational work you and your team have accomplished, I will now present some advancements and infrastructures that build upon your pioneering research. Shown in Figure A, the prodrug minoxidil elicits its hair growth effects post-sulfonation by the sulfotransferase enzyme located anatomically in the outer root sheath of the hair follicle, shown in Figures B and C. The SOLT1A1 activity has since been determined to be a predictive marker for individual minoxidil efficacy and hair growth. Our goal, then, is to maximize follicular sulfotransferase protein expression to increase minoxidil response in patients using this medical therapy. Topical 1% tretinoin has been studied and found to be an effective SOLT1A1 upregulator, converting 43% of minoxidil non-responders to responders. When tretinoin is compounded with minoxidil, the topical has shown non-inferiority in efficacy when applied once daily as opposed to twice daily, helping to increase patient adherence and compliance. Scalp microneedling has also been shown to upregulate sulfotransferase and works synergistically with minoxidil. That being said, let's explore a recently optimized microneedling protocol. A 2024 study on microneedling as a monotherapy for hair growth found that needle depths of 0.5 millimeters elicited better results than 1 millimeter, which elicited better results than 1.5. All needle depths grew hair. Shown in figure C, it is hypothesized that the shorter needle depth of 0.5 captures both the benefits of wound healing and increased permeability of topical adjunct therapies without disrupting the stem cell bulge, illustrated in figure D. So as of 2024, 0.5 millimeter needle depth is the new gold standard for microneedling. Next, should we consider maximizing topical API penetration? Of course. Solvents such as propylene glycol and ethanol have been found to increase minoxidil penetration. Microneedling and tretinoin also increase minoxidil penetration. Best practices are to microneedle after application of topical minoxidil. Based on the inventions of a single and narrow diagnostic and prognostication tool, let's examine an effective titration protocol to maximize minoxidil efficacy while mitigating treatment-related adverse events. Now, for this next section, I advise referencing today's Hair Talk video recording to examine this specific protocol, as I will not be orating all of the steps in detail here. Non-responders should use the following titration protocol, which mitigates scalp irritation while maximizing efficacy. These mitigation strategies include adjusting APIs, solvents, and frequency of application. Here's a protocol for other treatment-related side effects such as blood pressure. Similarly, here's a protocol for minoxidil responders and an alternative protocol for those with seborrheic dermatitis and or scalp inflammation. In summary, the aforementioned protocols maximize topical minoxidil efficacy while at the same time increasing patient compliance and adherence, 2 for 1. You will see that the percentage of non-responders converted to responders with this updated treatment protocol are not noted on the screen. Our team will present on these statistical values early in 2025. The results look very promising. Next, we'll examine our personal case study, demonstrating blood flow as a predictive marker for topical minoxidil and potentially other topical medical therapy response with similar mechanism of actions. Scalp blood flow in balding scalp regions have previously been shown to be in a state of hypoxia when compared to non-balding scalp regions. We know minoxidil stimulates cutaneous blood flow in the scalp, and it has been demonstrated that peak minoxidil-induced scalp vasodilation is correlated to minoxidil efficacy. However, it would be incorrect to assume that all vasoactive topicals promote hair growth. For instance, topical menthol increases cutaneous perfusion, but it does not promote hair growth. The mechanism of action of vasodilation was further explored in this case study. Several arterial tissue constituents modulate vasodilation in the microvasculature bed. Minoxidil increases cutaneous perfusion by relaxing the smooth muscle cells in the myogenic arterial tissue. Topical menthol, on the other hand, increases cutaneous perfusion via the endothelial, but it does not promote hair growth. It has been shown to be a vasoconstrictor of the smooth muscle cells, and these nuances are very important. Laser Doppler flowmetry and photopulse plethysmography signals can be transformed from time series to frequency series domains, allowing for the isolation and examination of each individual vasoactive arterial tissue. In our case study, a novel non-invasive scalp-worn PPG device was used on several patients to record scalp blood perfusion at baseline and after minoxidil intervention. Several device modalities in scalp regions were tested. Shown here is the change in the myogenic tissue activity and the perfusion over a 65-minute period post-topical application of 5% minoxidil. We are now focusing on where my mouse is, in this region, the purple myogenic region. Over the course of time, we see that the activity increases, and it peaks at minute 40. Then it drops and eventually sustains towards minute 60 at 100% higher activity compared to baseline. The total perfusion and contributing myogenic activity was then compared to a set of SOLT1A1 responders and non-responders. The SOLT1A1 non-responders did not experience an increase in cutaneous perfusion compared to stabilized baseline perfusion prior to the application of topical minoxidil. The subsequent wavelet analysis in the myogenic region shown in purple also demonstrated the same. On the other hand, the SOLT1A1 responders did experience an increase in cutaneous perfusion compared to stabilized baseline perfusion. And the wavelet analysis in the myogenic region also demonstrated the same. In another embodiment, laser Doppler flowmetry was used to measure the same biomarkers, where a directional increase in myogenic activity was observed when higher concentrations of minoxidil were applied. AI was then trained and feature matrices were established using this data to classify and identify responders and non-responders to vasoactive topical drugs relating to endothelial and myogenic tissue response. In the case of minoxidil, an early algorithm begins to accurately predict topical minoxidil response within the first 5 minutes of topical application. To date, this is the first case study examining smooth muscle cell activity in the arterioles as a predictive biomarker for minoxidil response. For this reason, we hypothesize that other APIs with similar mechanisms of actions may have the potential to elicit hair growth properties. These two APIs, among others, are some of our new targets for future research, which we hope to share its findings at the end of 2025. Finally, let's go ahead and bring everything together. In aggregate, new advancements in computer vision and imaging technologies are beginning to assist us in the hair loss diagnostic process, increasing diagnostic confidence while decreasing the diagnostic life cycle. Aggregated big data allows us to monitor the progression of patients with diverse health comorbidities and provide optimizations to otherwise normal, and I'm putting quotes around the normal labs. The emergence of prognostication tests and devices increase our confidence when managing patient expectations and also aid in the personalization of treatment pathways. Today, AI is the worst that it will ever be. It continues to improve at astonishing and impressive rates. In the future, as AI continues to advance in its ability to personalize treatments and predict outcomes with increasing accuracy, the balance between hope and realism will shift. With more precise data on a patient's unique condition and response to therapies, AI will help healthcare providers deliver more tailored prognoses, reduce uncertainty, and improve patient outcomes. Over time, this will alleviate the emotional tightrope we walk, allowing us to offer patients more realistic expectations grounded in data-driven insights, fostering both trust and hope in the treatment process. Please feel free to reach out if you're interested in collaborating with us. We are looking forward to hearing from you all. Thank you again. It has been a pleasure to contribute.
Thank you so much. Wow, fascinating. I've got like 8,000 questions, but we'll come to the questions in a few minutes. So I'm going to ask one first, then I'm going to introduce our panel, and I have a bunch of questions for you and the panel. If I heard correctly, your research is suggesting when we do microneedling, I love the concept that you're proving 5 millimeter is all you need to go is 5. That's great. We don't need 1 and all this other stuff. Just whatever. I know that. You're recommending needling over topical minoxidil versus or a topical anything really versus doing the microneedling and then putting it on, or does it really matter?
I think there are some theories to suggest that both work at this point in time. I don't have the prerequisite data to say that one necessarily works better than the other. What I found with our patients is that some get an irritation feeling when they do it afterwards and others don't. So it's just, I would say it's up to your discretion.
Perfect. All right. So here's what I'd like to do. So if you've been with us before, we usually ask questions and then we have a special talk that we do next, but we're going to wait on that. So I'm going to introduce our panel to the group. again, I'm apologizing in advance. I'm going to get everybody's name wrong. Hi, Tanuj, you're here. Welcome. I'm going to get everybody's name wrong, and I apologize in advance, so bear with me. Dr. Uh, Harsimaran Kaur, Kaur, I think it's Kaur, is a board-certified dermatologist from India. She works as a medical advisor and trainer for Kaya chain of clinics, one of the largest dermatology clinic chains in China. She has 11 years of experience in the field of dermatology, facial aesthetics, and trichology, and has worked on over 10 plus research studies. And I visited Kaya when it first started many, many years ago. I love Kaya. Dr. Komal Dalal is a facial plastic surgeon from India. She runs a successful clinical practice in the field of cosmetic surgeries and facial aesthetics with an edge in trichology. Dr. Komal has numerous academic and clinical accolades to her credit. Dr. Arunda Abrol is a MD DNB in dermatology and has completed her fellowship in lasers and cosmetic dermatology. She practices in Delhi, and her key areas of interest are trichology and injectables. Dr. Mahesh Ghazavi is an accomplished MD in dermatology and an expert hair transplant surgeon. With his team's skills, with his specialized skills and in-depth knowledge, he has successfully treated numerous patients, providing advanced solutions for hair restoration and dermatologic care. And Dr. Garima Balbande is an MD in dermatology and an active member of the IADBL rapport. She is dedicated to providing expert dermatologic care and stays up to date in the latest advances in the field. So I have some questions, and the first one is for Arshan. And again, you sort of answered this, but I think it's good to hear it again. So with all this AI-driven diagnostics, I think the question that they pose is it an how will it improve early detection of hair loss? Well, I think that's an obvious, right? And then, but that allows us then to sort of adapt the treatments, you know, predictively, right? If and is so I guess the question that I would ask from this question, if somebody has, you know, you said if they're you can pick it up, they can start in their teenage years, you know, people, we all see people in their teenage years. Is there an AI model being developed or your model that can tell us that, you know, that Johnny's hair at 15 is starting to lose hair, and at 30 he's going to be really without a lot of hair, or by 70 he's going to have that same amount of hair loss? Is that something we can look forward to learning about? You're on mute. You're on mute. You're on mute.
Yeah, I think that's a really interesting question. And you know what I'll say is that from what we understand about the pattern of loss is that it can slow down and speed up and slow down and speed up. And a lot of this influences on what's going on with the patient in their life. Are they going through stressful events? And in some instances, you know, when it does start or is just about to begin, let's say you're looking at a patient who it doesn't look, globally speaking, doesn't look like they have any hair loss. They have just a mature hairline, and they go through a traumatic experience, and then all of a sudden they come in and they get diagnosed with androgenic alopecia. Now, it's possible that they experience something called telogen effluvium unmasked androgenic alopecia, where it kind of spun that forward. Now, to answer your question directly regarding actually being able to prognosticate and see the disease going in the opposite direction, that's interesting. I don't think I have the prerequisite knowledge to give a comment on that, given that I'm not studying that, I'm not researching that. We're looking at the reverse, to be frank, to see if the drugs are actually going to work for you. But that would be very interesting to know.
I will task you and Andy to fix that, find that solution, and then we'll give both of you the Nobel Prize. Okay. So, all right. One more question for you before I move on to the whole panel. I spend a lot of time as editor of a few journals in dermatology. I get AI papers every day. And I'm on several panels over the last few years with groups of docs talking about AI in cosmetic surgery, AI in melanoma detection and all this other stuff. I struggle with the potential ethical concerns that people bring up with AI, and mainly dealing with healthcare data and things like that. So I know, without knowing what you've done, I know this is part of your discussion set, with all your people that you're working with. How do we as clinicians feel the most comfort using AI and making sure that the data is safe, and that not going to be that's my question. You sort of know what I'm asking.
Right. So, we're familiar with obviously doing informed consents to the patient and data anonymization. Data security is a big problem. Even today, Facebook's getting hacked. Our credit cards are getting hacked, right? So, I think what it comes down to is the confidence that we have in the company that's providing that security and providing those tests to us. Also, it's possible for us to keep all of these data sets local, so it's not on the cloud. So if the physical box is stolen, then it's stolen, but then at least you can't get hacked from a cyber attack. And so one thing that could, help us manage this is to essentially download the algorithm into a local database that exists locally in the facility of the physician's office. And so long as they don't have a break-in in the facility, then there's no, extra folks that can kind of come in through the cloud and essentially tap into that data source. Now, obviously, that's not a convenient, it's not a convenient solution, because a lot of this data you ultimately want to give back and retrain and whatnot. So there's going to have to be ways that the physicians can essentially have a level of comfort, while at the same time it being pragmatic for the companies that essentially want to use that blinded data to continue improving the model. So that's a great discussion and a great question that I think warrants further discussion.
Yeah, I struggle with it all the time, but again, I think it's there, and everybody on the call and everybody, all the panelists, if you want to pipe in when it's about that, you can pipe in. But it's the biggest. It could potentially be the biggest roadblock to AI in our field. Is the security issue, but I'm hoping we all succeed, and all these, like your company and your products and all the different algorithms that I'm dealing with in the skin cancer world and in the facial world. I hope it all works. All right, so Arunda, your first question coming to you. What are the hurdles that you face while curating personalized treatment plans for patients with alopecia? And again, do you think AI is a good thing to help that?
Yeah, so thank you, Dr. Gold. So, whenever we're talking about management of alopecias, I feel the first and foremost factor is, of course, the diagnosis. That has already been discussed at length by Dr. Arshan, that AI algorithms would definitely help us to analyze the scalp images and trichoscopic patterns with a remarkable accuracy to identify the patterns of the hair loss that may not be visible to, or that may be missed by the human eye. So this would enable us for early detection of the treatment, which would again be further for crucial for preventing further hair loss. But beyond diagnosis, when it comes to treatment plans and personalized tailoring of these treatment plans, I feel AI would help us to assess, individual genetic makeup, the lifestyle and hair loss patterns, laboratory parameters to ensure a personalized approach that would increase the likelihood of success of our treatments. And then one of the common hurdles that we face while treating the patients of alopecia is that, when these patients will ask us, will I get all my hair back? Or how much improvement can I expect of if I complete so and so number of sessions as advised? So I feel the predictive value of our treatments based on whatever trichoscopic features we are seeing is something AI can potentially help us with. And then, of course, your follow-up consultations, the monitoring becomes an issue. The hair growth progress may not always be as evident during your follow-up consultations. So I feel AI would definitely give us an edge with respect to the real-time monitoring of the scalp's health, the progress of the hair growth by, accurately detecting the counts, the hair density, the hair diameters, etc. Yeah,
Okay, thanks. Yeah, it's always frustrating sometimes when I see a lot of patients a day in the medical side, and a lot of them are hair loss. And you the patient is responding, whatever you're doing, they're responding and responding.
exactly.
And then they come back and and it's not a telogen effluvium flare. They just start losing hair again. And there's no body stress, and there's no surgery, and there's no lifestyle stress. And what you're doing seems all of a sudden not to work. So again, I think that's where Arshan, the AI prognostic stuff would be so big and so helpful in what we do. I think it's great. I want to learn so much more. All right, Dr. Pronounce your name for me. Besides Dr. Carr, what's your first name?
Dr. Harsimran. That's right.
All
You're
right,
pronouncing it very good.
I was pretty close. All
Yeah.
right, so what are the basic criteria you follow when determining a patient's suitability for advanced hair loss therapies of various kind? And again, do you think AI is going to help this process?
So the basic criteria I follow is first assess the type of hair loss, duration of hair loss, what are the comorbidities, what is the treatment history of the patient like, what are the stressors, if there is any cure for the stressors, and how much time the patient can invest into treatments. So these are the criteria I follow, and definitely AI can assist in determining because it gives a very reproducible and accurate diagnosis of the hair count and the hair growth patterns. So it definitely assists in diagnosis. For example, if we commonly get stuck between cases of chronic telogen effluvium and of early pattern hair loss, so AI can apart from using the macroscopic clinical scales that we do, that is the Norwood Hamilton or a Ludwig scale, AI can definitely help us give us better images of hair miniaturization or if there's any vellus hair growth, and catch these cases which are evolving early, and you can check for precursor patches of hair loss, which if you catch them early, you treat them better, so that improves your treatment outcomes also. Again, in cases
Yeah,
of alopecia areata, for example, I've seen clinicians run away from salt scoring, or so it can definitely help in, because the scoring pattern is so extensive and complex. So an automated counting system will give you the right values, and then you can, modify your doses accordingly of the immunosuppressives and immunosuppressants. And definitely, yes, AI can see what the naked eye clinical assessment cannot. For example, you might miss out on simple things like an oily scalp or dandruff when you assess clinically, but AI imaging definitely gives better diagnosis for scalp sensitivity as well as uh, oiliness of the scalp, or if there's any residue or scaling. So that definitely helps in better assessment and treatment planning for the patient.
great. And you made like one of the most important things I tell every patient. I don't even know if you realized that you said it. This is a patient journey, right? Especially, even when I do hair transplants, it's not over, right? And
Correct.
so if you have to, I'm sure we all have had patients that come in and expect us to be able to, make their hair grow in 2 weeks. And it's just, it's something we need to make sure we always are telling patients this is a lifelong journey, right? If your loss is bothering you, we have lots of methods to make you better. And we will choose what we think would work the best, and how that is to be. but it's not going to be 2 weeks or a month or whatever. This is a journey. And if the patients don't understand that, that's going to take a lot of explaining, because you got to do that. All right. So, Arshan, I'll ask you another question. Are there emerging technologies that you know of, such as gene editing or cloning, that could possibly revolutionize hair restoration therapies? You're on mute, so you're still on mute. Mute. Get off mute.
Mute it again. There we go.
There you go.
Yeah, actually, right up the street from us, right behind the UCSD campus, is Stemson Therapeutics, and they've been working on iPSC-derived pluripotent stem cells and redifferentiating them into the dermal papilla. So it starts with a blood draw, and then they go through the redifferentiation process, and they've actually essentially put these follicles in mice, nude mice, and they've been able to grow hair. And these are, human derived. And then so they then tested it on guinea pigs, and they got some good results there. And I believe last I heard they were going into phase 1. It was a couple days ago I heard that they shut down. So this was after raising about $22.5 million in funding. One of our other collaborators, Dr. Richard Chafu, who's at Scripps, served as their medical director. And so we'll be doing a follow-up call with him and seeing what's going on. But really, they acquired the assets of, I think the current chief medical officer of Bosley was working on a similar technology on bioengineering and essentially coming up with, the hair. And then they ran out of money. So then Stemson acquired them. And then now they're out of money. And they were already working with artists, because if you can essentially create, 100,000 hairs in a petri dish, transplanting those by hand, how many weeks is that going to take, right? So then they were working with artists to essentially get all the hairs loaded up, and then the robot comes and puts them in one by one, or something like that. So that's
Okay.
the extent of my knowledge regarding Stemson, and I hope that they get funded, because their research is really exciting.
That would be great. So for those that don't know, Artis is the robot technology from Venus Concepts, or Venus AI, I think they call themselves now. And that's why I did 3 of them this past week. And we still do we use the robot to take the donor hair. But I'm still a big proponent. We actually put them all in ourselves. And when you're doing 1,000, 2,000 grafts, one at a time, it's very time consuming, but the robot has the technology if you want to be able to implant too. So that's interesting. Okay, Dr. Mahash, what distinguishes QR678 Neo from other existing hair loss treatments? We're going to have a talk about that later, but we want to know your thoughts. And how has it changed the landscape of non-surgical hair restoration? And for those on the call that may not know what QR is, spend up just a second telling what QR is, if you don't mind.
Thank you, Dr. Gold. QR, we tried QR678 solution. Those patients who have like vellus hairs, have miniaturization of the hairs, it works very nicely. QR convert these vellus hairs nicely into the terminal hairs. But those patients who have the complete hair loss, those not having any active follicles on the scalp, we face biggest challenge for QR treatment. But it works nicely in initial grades of the hair loss. If you see miniaturization of the hair, you can just start QR678. We tried many patients with monotherapy with QR678. Then within 3 sessions, we got decent results. We had seen increase in the terminal hair growth rapidly as compared to other conventional line of the treatment. Plus, we found QR is better working as compared to your PRP, growth factor concentrate, and the rest of the less standardized procedure. So it works in a very predictable way.
Okay, great. Again, we're going to hear more about QR. So just that'll be a bit. The next question will deal with QR and so forth. I find QR678 to be fascinating, and just for everybody on the call, if you're in the US, we don't have it. It is an injectable product. I'm sure you can use it topically, but we can talk about that. But it's, the studies that I know of have been done injectable, and in the US, an injectable growth factor-ish type of product becomes a drug. And therefore we can't, unless they go through the many, many millions of dollar FDA pathway, it's not going to happen. And topically it's not yet here, but it's something that we could probably bring in and use topically with microneedling at some point if we could find the right way to bring it in. All right, thank you so much for that. And then Dr. Komal Doshi, how do you distinguish between patients who are better suited for QR678 alone versus those requiring combination therapies like PRP exosomes or hair transplantation? And do you think that AI can streamline or even perhaps guide you in the right direction to do this?
Thank you, Dr. Gold. Actually, I have seen results with QR that works wonder with all kind of Norwood grade 1 to 4. So it actually doesn't need any other combination therapies with PRP or anything. But yes, uh, other patients where active hair follicles are not present, and so that kind of patient need hair transplant and other active therapies. And of course, with AI and emerging technology, it helps us with prognosis and better diagnosis. So it helps to predict the number of sessions required and also reduce the potential error it may happen with us to bias the treatment, choose the treatments over other treatments. So yes, with emerging technology, it can choose the effective treatment plan for the patients. So it can, of course, potentially improve the success rate and also the patient satisfaction.
Right. And I think we can actually, when we're done in a second or two of the question part, the world of exosomes has become very popular. And I'm curious to get Arshan, your take on, have you guys ever, obviously minoxidil's been around, and the amazing work that you and Andy have done with that is incredible. But has anybody started looking at what a potential exosome in this world of AI can do?
I haven't. I don't know of anyone who's looking at prognosticating whether exosome therapy is going to work or not. I think we had a previous speaker talk about some new exosomes, and there's always new exosomes, coming out that have, different concentration of growth factors to help, nourish the hair. Ultimately, it would be interesting to use our VasoScan device, and this is something that, we're really excited about, because at the end of the day, you can put it on the scalp and wear it. And, previously in the picture shown, you had to shave the scalp to actually be able to get that signal, because, it's photons that we're sending at the scalp. But now you can do it without shaving the scalp. So it's a lot more versatile in its use. So I would be interested to, collaborate on a potential project like that, where we actually measure and look at the changes in vascular flow before, and after application of exosome. What I will say is that there's some research suggesting that some of the exosomes are working in, synergistically with the actual microneedling in and of itself, and the mood response that is causing. So, kind of differentiating between the two is going to be something that, we'd have to do to come up with something that's, reasonable in terms of our understanding.
Okay, I work with a lot of the exosome companies here in the US, so you and I'll talk later. Because if it's something we can look at, I think that would be great. All right, the next question, Raji, I'm going to skip you for a minute because you're going to talk on QR. So coming back to that.
Yes,
Dr. Garima, hi.
Hello,
How are you? How do you think patient compliance will be with the emergence of AI? And can you share your views and experiences so far?
Yes, thank you, Dr. Gold. And it's like Dr. Arshan, you had an excellent talk. First of all, I just want to mention that while we progress the tracking and the feedback of the patient, when the patient walks into our OPD, First of all, with the help of AI, we can have the visual feedback that is in before and after the comparison pictures, because sometimes patients also say that we are applying minoxidil, but the proper results and they have lost follow-up also. They're applying in a week or two or not in a continuous motion. So behavioral nudges. So with the help of AI, we can send in reminder trips also. Like you have to apply minoxidil daily, and we can have an educational awareness also that he or she has to apply it daily, because we cannot mention like this if you will be applying once in a week and you will have an excellent results with it. So it is impossible. So with the help of AI, the compliance will be better. And I think for the accurate diagnosis, we can have a pre and post scalp images so that we can show the patient that this is your scalp hair density previously, and when you have used for a month or while, so this is your scalp density later after a month, 3 months, or 4 months. The progress and the importance of AI will be there for sure. And as we have seen, we have discussed, we can have a personalized treatment plans also as per the lifestyle of the patient and as per the medical records. And I agree with Dr. Arunda and Dr. Harsamran that we can have the medical laboratory reports. If the, as Dr. Arshan has mentioned, if the patient is having a thyroid, or if it's a calcium deficit or any other laboratory parameters are involved, so AI tool can help to improvise the lifestyle changes, and it can help to remind us to have what we can add in our diet along with our topical minoxidil and oral pill. And as we have added already QR to our session, so it's like a better accessibility if we have a AI in our diagnostic routine, I must say.
Thank you. Yeah, I mean, I think that's fascinating, Arshan. You know, in the facial world of AI, I've worked with companies. You take all the photographs and take all the lifestyle stuff, and then you can actually predict through imaging or AI imaging what that patient will look like if they follow what you do, right? And or if you want to say, tell me what dermal fillers are going to do for this, that part shows up. If you want dermal fillers and CO2 resurfacing, what that may look like. And that's where we're getting at. And I think what Garima said is great. If that's doable, here's the patient at baseline, we do all the studies in the AI stuff, and you take a photograph, another image or at 6 months or whatever, and then maybe we get predictive stuff of if they continue the journey, what it looks like in 2 years or 3 years. Obviously, no guarantees because life happens, but is that something we might look at some point?
Oh, 100%, definitely. I mean, the thing with fillers is, in 24 hours, you're just seeing it, right? It's right after you do it, it's there. And so, the cosmetic difference is instantaneous. Now, with hair loss, as we previously discussed, it takes many months for you to see anything in the mirror with the naked eye. The thing that these trichoscopy devices, particularly AI-assisted trichoscopy, is look at the micro differences in the thickness and the density of the hair where the naked eye can't see it. There was a study I was reading that showed that if the changes in the hair are less than about 15%, visually it's imperceptible to the naked eye. And so it has to be greater than 15% for us to visually see it. So if the patient actually has one of these devices at home, if we can decrease the cost of these camera devices and actually provide them to the patient at home, and I think we're getting there, okay? Then the patient, the same way when you try to lose weight, you step on a scale and it says -1 pound for the week, you're going to go, eat a turkey Subway sandwich, right? Not McDonald's. To give you positive reinforcement, the patient can weigh themselves, take a picture after 3 weeks, after a month, maybe see some shedding or some indication that something at the very least is happening. And so that can help, take you through the process, maybe from months 1 to 6. A lot of times we have patients give up within the first 30 days, citing that, oh, it didn't work. I don't know. I don't think it's going to work. I don't think it's going to work in 6 months, and they quit. And so having a prognostic test that can tell you, like, for sure that this thing is going to give you a result. What the result is another question. How much hair are you going to grow? What is the density going to look like? In what regions of the scalp is the density going to look like? But we have the tools. We have the foundational puzzle pieces to approach answering this question. If we're able to look at the disease state, on day 0, prior to treatment, and we're doing the blood works and we're gathering that data, and then we treat the patient using an objective, treatment pathway, and then we monitor and we see how they progress, and we can see the changes in the skin, the lesions that exist, the hair. Then we can cross-reference that data with new patients and how our algorithm actually predict what's going to happen with that patient. And this is an area that we're actually interested in researching in. So we hope over the next, I don't think it's that far away, but we hope over the next couple of years, more is going to start to roll out.
Perfect. Thank you so much. All right, so we're gonna move ahead. So Dr. Raji Patel is a dermatologist. She's also the Assistant General Manager of Medical Affairs for QR678. So we'd like for her to give us an update on QR678, and then I'm going to follow that. I'm going to ask Tanuj to speak when you are done, Raji, so we can have I battered global cosmetic surgery at the beginning, but you're the boss, so you'll be able to give a talk on global cosmetic surgery, and then we'll wrap things up. So Raji, tell us what's going on in the QR world.
Thank you so much for the wonderful introduction.
That's on mute.
EGM of Medical Affairs QR678. QR678 is honored to sponsor Global Cosmetic Surgery Hair Talks, and I'm excited today to be sharing the insights and innovations shaping the future of hair science. Expanding horizons, introducing the next generation of QR678 innovations. At QR678, we believe in science that delivers products backed by research and innovation, tailored formulations to meet diverse patient needs, accredited, approved, and clinically proven products that are safe, effective, and trusted by dermatologists globally, thereby unlocking the potential of cutting-edge regenerative medicine technologies for our patients. QR678 Neo is the best-in-class hair regrowth therapy, a revolutionary procedure for managing alopecia. QR678 Neo is clinically researched and a minimally invasive therapy to manage all etiologies of hair loss. It contains biomimetic polypeptides that mimic the growth factors naturally present on the scalp. The 2017 US patent, the 2019 Indian patent, the regulatory approvals in 10 plus countries, and a CE certification in European Union has added to the crowning glory of QR678 Neo. The QR678 hair regrowth system. This comprises of the Neo along with the QR678 suite, that is the shampoo, serum, and the nutraceuticals that helps to anchor and amplify the newly activated follicles. The synergy of the doctor-driven therapy, that is QR678 Neo, and the home care therapy of the suite has helped to deliver better results as compared to using QR678 Neo alone. As we embrace the exciting advancement in exosomal technology, we continue to consolidate the promise of innovation, efficacy, and clinical excellence. The buzz around exosomes is undeniable, as with any other breakthrough in science. But the question still arises, are exosomes enough? There is always a gap in the hair restoration segments available in the market, hence the constant need for newer innovations to fill them, thereby introducing bioengineered exosomal hair growth factor complex, that is the BEHC. It's a cutting-edge formulation combining biomimetic polypeptides with plant-derived exosomes. Biomimetic polypeptides, as we all know, are factors that mimic the natural growth factors present on the scalp. Plant-derived exosomes are natural extracellular vesicles that have regenerative capacity. Let's look at the three-pronged synergistic effect of this combination. Plant exosomes direct signals to the target cells better, thereby ensuring that growth factors reach the intended site of action effectively. They prolong the therapeutic effect of the growth factors by increasing the bioavailability. This picture depicts the synergistic effect of the biomimetic polypeptide with the exosomes, thereby ensuring predictable and sustained hair regrowth. Continuing with the buzz of exosomes, let's take it to the next level and make it a little more powerful. How about combining it with PRP, or maybe something much more better than PRP, thereby introducing PDGF enriched formulations. This is a combination of platelet-derived growth factor along with plant-derived exosomes. Let's see how the platelet-derived growth factors work. It promotes vascularization of the hair follicles, thereby increasing the supply of nutrition and oxygen to the hair follicles. It rejuvenates the hair follicle, initiating the hair cycle's anagen phase. It improves the follicular anchorage by increasing the extracellular matrix synthesis. So why is it different? The concentration of PDGF in these formulations is 10 times more concentrated than PRP. Hence, a faster onset of visible regrowth with improved density. What is the advantage? Unlike the normal PRP, which varies based on the preparation technique and the platelet quality, this formulation ensures that precise reproducible concentrations of PDGF is delivered to the patient, thereby ensuring uniformity across all treatments. It also addresses the limitations of autologous PRP therapy by reducing the preparation time, eliminating donor variability, and increasing therapeutic consistency. It is backed by preclinical and clinical studies validating safety and efficacy. Imagine a solution for graying hair. Next-gen melanin synthesis is what we have. It is an advanced formulation enriched with specific biomimetic polypeptides to tackle tinnitus. It targets melanin synthesis directly at the follicular level, supporting natural pigment restoration. Biomimetic polypeptides bind to the receptors on the melanocytes, stimulates the tyrosinase activity, enhances melanogenesis, thereby increasing the transfer and the synthesis of melanin to the keratinocytes. From science to solutions, the integration of PDGF, biomimetic peptides, and exosomes represents a revolutionary shift in treating hair loss. These solutions focus on regenerative pathways to treat not just symptoms, but the root cause of the problem. At the heart of it all lies the QR678 Neo, ushering in the next-gen exosomes, the next-gen IPRP, the next-gen melanin synthesis, and you never know what's next. Introducing QR678 Skin RX, the brightening solution and the anti-aging solution. Watch this space for more. Thank you all for your kind attention today. That's all in the innovations in QR678.
Great. Thank you so much for that update. So I'm gonna ask Tanuj to introduce himself and introduce Global Cosmetic Surgery.
Well, thank you so much, Dr. Gold, for stepping in this morning. I'm sure you all realize, but I think that one of the moving parts of coordinating international webinars is all the time changes, and so North America, we had our start time a little off, and so apologies to people who had to log in late. The good news is these talks are going to be available later online, so if you missed the beginning, we'll be able to give you links to watch the full talk by Mr. Ommid. Thank you, Arshan, for coming on today. Really enjoyed having your insights to hair loss and the future of AI interfacing with these technologies. I mean, clearly we have a fascinating future before us. And I think seminars like this, where we have people at the forefront of the industry that are pushing the field forward, along with clinicians all talking together, it just makes the entire field move forward in a more pragmatic manner. Hopefully you found that some of the interactions today, you'll go back to work on Monday and maybe tweak some of your protocols slightly. The world of hair transplant surgeons and physicians are listening to you to help guide us as to where the future is going. So we look forward to more of these hair talks. Just a quick comment and explanation of this organization. So Global Cosmetic Surgery, we were founded in 2020. Dr. Deborah Shom and I in India, and I'm in the United States. We founded this organization at a time when people could not gather together in person to share intellectual debates and concepts in medicine. And since that, has grown into a wonderful organization where we have regular international webinars that span the entire field of aesthetic surgery, non-surgical and surgical. We have these regular hair talks. And Michael Gold, we cannot thank you enough for being a mentor for the hair talks and helping to curate the panels and curate the speakers. And for those who don't know, Dr. Gold is not just an icon in the field of dermatology, but also in the hair world. His accolades are endless, but a few of them are that he sits on, as he mentioned, so many of the various important journals of the dermatologic world. And that's really, I would say, the apex of academics, when you are responsible for curating and publishing science as it's happening. So to have Dr. Michael Gold on our team helping to curate these talks is just wonderful. We really appreciate everything you do. And it makes a difference because these talks generally have thousands of people logging in from around the world. So we take this role that we have as an educational platform seriously. And also just wanted to close my comments by thanking all of the panelists for joining in. You know, everybody brings in a perspective from their own clinic, and we really appreciate Dr. Brol, Balpande, Kaur for speaking today and giving us more insights. Now, we do have another aesthetic talks scheduled on January 11th. It's going to be Dr. Julie Woodward from Duke University. She's an oculofacial plastic surgeon, and she'll be speaking on non-surgical aesthetic rejuvenation of the periorbital area. She's a world expert in this topic, and so we're really looking forward to having her speak at our next session. In the meantime, to everybody around the world, we're wishing you happy holidays, happy New Year, wishing everyone spend a little time with their families and recharge so we can all tackle 2025 with renewed vigor. Any additional comments, Mr. Ommid, before we close down the session for today? Again, thank you so much for joining us today, and we appreciate your contributions.
Yeah, my pleasure. And thank you for having me. Look forward to contributing in the future as we come out with new research. And looking forward to it's been such a pleasure to be here today and speaking with all the other panelists and getting an opportunity to meet you all. So thank you for having me.
Great. And then just, you know, I'm sure we all noticed that Mr. Ommid has a great head of hair. So you could probably be, you know, a model for your own company right there.
The before and after pictures are convincing.
Yeah. Well, let's hope amongst this crowd right here, everyone can appreciate this, but let's hope for a very hairy 2025 and beyond in a good way. Happy New Year to everybody. We'll see you on January 11th for the next aesthetic talks. Thank you, everybody.
Happy New Year, everybody. Happy holidays.
Happy New Year, everyone.
Yeah, happy holidays to everyone.
Thank you, everybody.
Thank you so much.